for the year of 2018. I'm very happy to see that there's a lot more new faces that we were used to tonight, so thank you very much. Welcome. My name is Nicholas Pirlo, and I will be the MC for this evening. I'd like to apologize in advance. I've got a slight cold, so if I sneeze into the microphone, I apologize first in your eardrums. Our presenter for this evening is Dr. David Sabapathy. He is a public health physician here at PEI and is a fellow of the Royal College of Physicians and Surgeons of Canada in Public Health and Preventative Medicine. He wishes me to tell you that he grew up here on PEI, so he's not come from away, he's from here. And that Sabapathy is a Gaelic equivalent of the last name MacLeod. The title for his talk this evening is The Unexamined Life of Public Health, and without further ado, I'll turn it over to him.
Thanks, Nick, for that introduction. And I'm going to explain that in a moment because it's actually relevant to this evening. Now, it's great to be here sharing a drink with you tonight, what I hope will be some great discussion. But before we go any farther, I have to warn you, if you came to hear a great theologian speak, you may be in the wrong pub. I think that might be down at the Churchill Arms, where they're serving a nice chicken curry. No, I'm afraid I'm a public health physician, and you're at a public health talk. But not any public health talk. I'm here to talk about my Christian faith and my work. And before you start heading for the door, especially those of you at the back, you can see you there, the good news is that there's beer. The better news is I see some of my public health colleagues here. So when we get to the question and answer period, I think you'll find it very interesting. Now, this evening I'm going to make the claim that public health practice is deeply rooted in a Christian perspective of the world. And I'll start by owning up to that shameless introduction, that shameless ploy. Sabapathy is not a Gaelic name. I know you're disappointed. It's from Sri Lanka. And this is relevant tonight because after all, how did a Sabapathy come to speak about Christianity and public health? Well, you see, this Christian worldview was passed on to me by my father, and his father before him, going back into India. And on my mother's side, her family going back many generations here in PEI. On my father's side, few documents survived the war, with the exception of this tattered Bible, owned by Sithumbram Sabapathy, my great-grandfather, with a verse from 1 Timothy found in faded handwriting on the inside cover. We have our hopes set on the living God, who is the Savior of all the people. Now, I'll put the Bible aside. I don't want to scare off too many people this early in the talk. But you see, as we trace this legacy back, even much farther than this, we find that as a Christian, I stand in a tradition, reaching back to Judaic roots, and in fact, to the beginning of time. And as we'll see under this tradition, public health isn't just a job, it's a responsibility, an obligation, and a calling. In fact, for everyone here who is passionate about human health, I'm going to argue tonight that you too stand in this tradition and appeal to this calling. So it's not just me, but you and I together that tell the story. Now let's begin by talking about what public health is. And it's fitting we're in an Irish alehouse tonight because of his many legacies. The Irish-born physician and medical officer of health, Sir Donald Aitchison, gave us a definition of public health: the science and art of preventing disease, prolonging life, and promoting health through the organized efforts of society. There's a lot there. But in this definition, Sir Aitchison provides three factors that define public health. Public health as a science, public health as an art, which we'll call ethics, and public health as the organized efforts of society, which we'll call leadership. Now let's distinguish between public health and public health care. You see, public health care cares for people who are sick by means of hospitals, healthcare providers, and medications. Whereas public health works outside of the healthcare system to keep entire communities healthy by preventing disease and injury before it occurs. So public health focuses on populations rather than individuals, and prevention rather than treatment. And this involves many stakeholders, such as civil society, the public and private sectors, volunteer organizations, and people that are passionate about human health, like you. Together, we've contributed to the great public health achievements of the 20th century, and I'll just mention a few here. Immunization and control of infectious disease, access to safe drinking water and sanitation, safer and healthier food, tobacco control, motor vehicle and workplace safety. And over the past 100 years, these public health achievements have dramatically increased global life expectancy by over 30 years. A remarkable feat. However, around the world, health is at a tipping point. You see, we are aging around the world, with people over 60 years set to double in the next 30 years. We've shifted from a world of communicable disease, such as tuberculosis and malaria, to a world filled with chronic disease, with cancer, cardiovascular disease, diabetes, and chronic lung disease now accounting for 70% of all global mortality. When we include the growing issues of mental illness and substance use, we see that for many in the world, health isn't improving at all, but trending in the opposite direction. But I'm not here to discuss whether or not progress in public health is occurring. That is a different talk. Rather, what I want to speak about is something more foundational. That public health science, ethics, and leadership all rely on beliefs about the world in which we live. And these beliefs are not independent, but draw on a foundation provided by a Christian worldview. Now, in practice, this foundation is often assumed, rather than examined. That's the name of the talk. But not tonight, not at Theology on Tap. Tonight, we will bring it to the surface. But first, what do we mean by a Christian worldview? Well, a worldview is a set of ideas, beliefs, and values through which we interpret the world and interact with it. Our worldview, consciously or subconsciously, influences our actions. Now, some suggest that a Christian worldview is difficult to define. Doesn't it vary according to personal opinion, historical periods, or particular branches of the faith? But the Christian worldview I will refer to tonight is the tradition in which we stand, has been held consistently throughout history, is universally accepted, and is publicly accessible today. It's found in Scripture, the historical Judeo-Christian record, and common statements of faith held by Christians around the world. It's that clear, essential, and unified view of Christianity that is the subject of this talk. And with that, we can begin our story together by examining the relationship between Christianity and public health science. Now, the scope of public health science is diverse. It includes, for example, microbiology and the biological sciences, environmental science, the social and behavioral sciences, and epidemiology. And all these sciences have in common two characteristics used in the scientific method: empirical observation and inductive reasoning. And we'll look at these characteristics in the context of epidemiology, which is the basic science of public health, defined as the study of patterns and causes of disease in population. And as we'll see, epidemiology, and in fact all public health science, is not self-reliant, but dependent on a Christian worldview. First, let's look at empirical observation. Well, what is it? It's the acquisition of evidence using our senses. In epidemiology, we use it to look for patterns of diseases in a population. For example, we count cases of foodborne illness or lung cancer. And it's all based on the fundamental assumption of epidemiology, that diseases in population don't distribute randomly, but in relation to their causes. Foodborne illness is more likely in places where there's poor sanitation, and lung cancer follows trends in tobacco use. But of course, this assumption is all based on a belief, namely that our world operates with regularity and predictability. When we look around, we see an ordered world. And even when randomness is initially perceived, when we look closer, we see only order. There is no such thing as a chance universe. It is because of this belief in order that we expect to empirically observe patterns of diseases arranged according to a pattern of causes. And it's because these patterns are reproducible that they can be used to predict and prevent future cases of disease. Now, imagine this wasn't the case. You and I are living in a chaotic world. Well, in such a world, no patterns of diseases and causes would exist to be observed. All diseases would be arbitrary and unpredictable, and public health would be left powerless to predict and prevent disease. So we have to ask, where does this ordered world come from? Is it unplanned or intentional? Some would say the former, that order is simply the accidental byproduct of chaotic processes. But this contradicts the notion of order. Order, by definition, does not come from chaos. Rather, we must look elsewhere for this mysterious source of order in the world, and we find it in a Christian worldview. On this view, the universe was created by and is dependent on God as a necessary condition for its existence. Order, which is discovered in nature and codified in laws, is not accidental but contingent on the providence of God. On a Christian worldview, since our universe is ordered, it is predictable and capable of being explored. And this makes epidemiology and all public health science possible. But you know, gathering health data, empirical health data about thousands of people is rarely feasible. It's costly, it's time-consuming. So we turn to another feature of the scientific method, inductive reasoning, which is simply this, a way of reasoning that takes specific observations and draws general conclusions. For instance, in epidemiology, we sample a few households regarding alcohol use. And using inductive reason, we draw conclusions about alcohol use in all of PEI. Well, inductive reasoning is also based on a belief, a very basic one. That is our ability to reason in this ordered world. There's two aspects to this belief in reason. First, we believe we can reason. And second, we believe that the world is not completely beyond our understanding. Now, that may all seem obvious, but the ability to reason is an amazing thing. Without it, we couldn't draw any conclusions about the health of the population. And without rational conclusions, there'd be no basis for public health action. So again, we must ask, where does our capacity to reason come from? Well, on some worldviews, it arises from the physical world in which we live. Somehow, it is a product of non-rational, unguided processes. But wait a second, how can rational thought come from non-rational processes? If our thoughts are merely the product of non-rational processes, then what basis is there to believe they can rationally assist us in understanding public health? We must return again to a Christian worldview to support even the belief in our own rationality. On a Christian worldview, we are made in God's image. And of course, there's many aspects to this theological concept. But it includes the assertion that we bear the resemblance of God in having the capacity to reason. And I'll grant you this evening, human rationality is extremely limited and fraught with error. But nonetheless, our reason can reveal to us important facts about the world. And it's this basic assertion that provides a necessary foundation for epidemiology and public health science. We can summarize our story so far in this way. The public health science operates using the scientific method. And the scientific method relies on beliefs, namely that we can reason in an ordered world. I'll admit, when I engage in public health science, I'm often assuming this amazing serendipity. But together, let's not forget, when we engage in public health science, we are drawing on the common understanding of a Christian worldview, that we are rational beings living in an intentionally ordered world. Now, of course, at this point, some of you may say, okay, certain worldviews don't seem to provide support for public health beliefs. But the worldview you propose isn't exclusive to Christianity, at least not yet. And I agree. And ask that you bear with me as we turn to public health ethics. Because as we continue our story, we'll see that public health relies on much more than science. It relies on moral imperatives. Recall that Sir Atchison, in his definition that he gave us, also described public health as an art. By art, he meant not only creativity, but a perspective supplementary to science that considers human health from the standpoint of value. You see, public health is in the business of translating scientific knowledge into societal action. And this involves ethical decision-making about what is morally right or wrong to pursue. For example, public health science develops a new but costly vaccine. Public health ethics decides who is eligible to receive it. Now, there's many ethical dimensions to public health, but overall there's two central moral imperatives: improving population health and reducing health injustice. And as we'll see, both aims arise from a Christian worldview. Well, improving population health is simple enough to achieve, on average, better health for a population, increasing physical activity and decreasing heart disease. Okay, but why is this a moral imperative? To understand this, we need to appreciate that public health recognizes health as a fundamental human right. In fact, this is enshrined in many international agreements, such as the UN Declaration of Human Rights. But recognizing health as a right relies on the moral understanding of the intrinsic value of human life. And by intrinsic, we mean all people are valuable by their mere existence, there are no other prerequisites to be met, and this value applies equally to all people. And it's because of this belief in intrinsic human value that public health recognizes health as a human right and sets improving health as a moral imperative. Make no mistake, if human health is not intrinsically valuable, then there can be no appeal to health as a universal right. Worldwide, there are 2.3 million preventable deaths each year due to HIV and tuberculosis. If life is not inherently valuable, each of these lives is not a right. It's at best a privilege. And no onus can be placed on society to protect these human beings. Again, we ask, where does this concept of intrinsic human value come from? Some would say it comes from nature. But in response, nature itself appears morally neutral and indifferent to the question. More commonly, it's proposed that intrinsic human value is a moral value arising from the workings of society. However, if this is true, then let's be clear. Intrinsic human value and health as a human right are then merely social conventions that are subject to change. But such a transient definition is at odds. First, with the meaning of intrinsic human value, and second, our universal appeal to health as a right in public health practice, which is an appeal to a constant, unchanging vision of human life. Rather, to find a basis for intrinsic human value, we need to borrow again from a Christian worldview. On this view, the universe and all life was created by God for a purpose, so all of creation is inherently valuable. Every human life is treasured simply for being who we are. On a Christian worldview, moral values like intrinsic human value originate from God's nature, so we can appeal to them as enduring facts that apply to all people. It is this Christian worldview that provides public health with the right and the motivation to improve human health. Now, it's one thing to improve health on average, but what if we improve health a lot for a few and very little for the rest? Diabetes rates are 3 to 5 times higher amongst the indigenous population in Canada. And tobacco use here in PEI is twice as high for low-income islanders versus high-income islanders. In public health, this is deemed to be unfair. So there's a second moral imperative that seeks to reduce unjust differences in health. To understand this moral imperative, we need to appreciate some background. That there's an overwhelming evidence that the greatest factors which determine health are the social, economic, and environmental conditions in which people live. Things such as poverty, illiteracy, homelessness, and social exclusion. And once we understand that living conditions have the greatest impact on human health, we are immediately faced with a dilemma. Because typically, it's political, social, and economic forces that establish these living conditions. And inevitably, it favors those with power, wealth, and prestige. As a result, around the world, it is the poor and disempowered that have the highest rates of illness, disability, and premature death. 99% of all maternal deaths occur in developing countries. And every day, 16,000 children die before their 5th birthday, with twice as many deaths in low versus high-income households. These are not anomalies, but are largely attributed to poor living conditions. 40% of the world live on less than $2 per day. 1 billion live in hunger, and 1 billion live in slums. For this reason, public health believes in the principle of distributive justice. Societal resources should be distributed fairly to provide all people with an opportunity for good health. Without this foundation, discrimination is possible. Some lives may be judged more important than others, and resources distributed to improve the health of some people at the expense of the less fortunate. And by now, you know the question: where does this concept of distributive justice come from? A common view is that it's a cultural norm, a product of social environmental conditioning. We developed it because it helps us survive. But help who survive? On this view, social groups define the meaning of health justice, and often this subjective definition favors those with power, wealth, and prestige, the same groups that contributed to health and justice in the first place. Without an uncompromised basis for health justice, there's little reason to insist on health for all. Rather, it's the transcendent, unwavering concept of justice that provides a universal platform for societal change. So we return to the grounding of a Christian worldview. First, distributive justice builds on the concept of intrinsic human value. If every human life is valuable, then all people should have an opportunity for good health. Second, on a Christian worldview, God is just in his nature. And it's because we are made in God's image that we have the idea of justice so deeply ingrained in us. We hear the call to fight for health justice in the world. So our story continues and reminds us of the following: that public health ethics demands that we improve health not just for a few people, but for everyone. And these imperatives assume the prerequisites of human value and justice. Let's be clear. There is widespread health injustice in the world today, and when I hear about it, it disturbs me. It angers me. Do you feel it? Because when we feel that sense of injustice rising up within us, we are appealing to a Christian worldview that values every human life and demands health justice for all. Now, at this point in our story, a picture has begun to emerge. The beliefs we rely on for public health science and public health ethics point to a Christian worldview. However, the worldview we're sketching is still not completely specific to the Christian tradition. And in the last section, we'll make those final connections. We'll do it through the lens of public health leadership. Because as we'll see, it's not enough to have a basis for public health moral imperatives. Public health leadership depends on applying these principles to public health practice. Okay. Returning to Sir Atchison's definition one last time. Public health leadership refers to the organized efforts of society to advance public health. And recall that living conditions have the greatest impact on health. But of course, most of these conditions, such as poverty and unemployment, lie outside the control of the health sector. Therefore, it takes all of society to advance public health together. And in this collective effort, people who are passionate about human health are bound together by a set of common beliefs. In addition to those underlying public health science and ethics, there's 3 shared convictions, namely belief in purpose, shortcomings, and hope. To begin with, leadership in public health starts with a firm belief in the purpose of human life. According to the World Health Organization, health is not an end in itself, but a way of enabling people to realize their purpose in life, their ultimate aim. The global campaign to eradicate polio has saved 13 million children from paralysis. There's profound meaning in this effort because each child's life has purpose. Following our pattern of exploration, we have to ask, where does this purpose come from? some would say it's a social construction. We each determine what has purpose in our lives. But note, on this worldview, there's no actual purpose in life. What appears purposeful to us in the moment, such as health, work, and relationships, is really an illusion. It has no basis in reality outside of ourselves. Others see life as a series of causes. Someday we'll find our purpose in the future by steadily tracking these causes backward with the aid of science. But again, even if an entire sequence of causes for human life could be formulated, the question would still remain: does such a sequence have purpose? Rather, the purpose relied on in public health refers to a much deeper conception, to a profound meaning whose source lies outside the natural world. And the Christian worldview provides this source. Our earlier observations, the ability to reason in an ordered world, and the concepts of intrinsic human value and distributive justice, well, these all lead to the inference that human life has purpose. On a Christian worldview, that purpose is ultimately found in a relationship with God. So the resounding Christian assertion is this: every human life has purpose. And this belief provides a compelling basis for public health leadership. But no sooner do we affirm purpose in human life than we are confronted with a startling fact: that we as society fail to pursue health for all. Unfortunately, this too is part of our story. The WHO declares that due to unjust living conditions around the world, and I quote, "social injustice is killing people on a grand scale," end quote. Such injustice is not a natural phenomenon. Rather, it's due to social norms and policies, which are the product of human choice. That is, our moral shortcomings. In the United States, differences in mortality rates between white and African Americans in the 1990s accounted for almost 1 million preventable deaths. Globally, 2 billion people live without basic access to low-cost sanitation systems. And while there's plenty of food in the world, right now, 50 million children suffer from acute malnutrition. Moral accountability for health on this scale cannot simply be deferred to society, but begins with all of us as individuals, where we are all guilty of prioritizing ourselves over others or being indifferent to the suffering around us. Even among those committed to public health, we find that self-interest, apathy, and strife undermine public health endeavors. You see, it's not just a lack of funding or a lack of scientific evidence that holds public health back, but the same weakness of moral character plagues public health itself. We are not only part of the solution, we are part of the problem. And if you're wondering, I include myself. But there's something funny here. Everyone agrees that health and justice must be accounted for. Something must be done. But individual accountability is surprisingly hard to find. Despite vast evidence linking human choices to health and justice, there's an odd incongruity here. Most of us consider ourselves to be virtuous. Fault always lies elsewhere. Now, in some worldviews, it's asserted that humanity is steadily making moral progress. Of course, this may be challenged by examining the great public health injustices that have endured over the centuries and continue in the world today. But more fundamentally, to propose moral progress implies an unchanging moral standard towards which we are progressing. Without such a standard, any notion of progress really is not progress at all, but merely morally neutral change. A Christian worldview provides a framework for understanding our moral shortcomings. On this view, an objective moral standard exists, originating from God's nature. We are made in God's image, so we have the capacity for reason as well as voluntary action. And together, reason and voluntary action can be used to fulfill or evade our moral obligations. And when they've been used to advance public health moral imperatives, real progress has been achieved, such as the increased access to clean drinking water for many in the world. Unfortunately, we've also seen the opposite, the neglect of our moral duty. Witness the atrocious workplace safety records and child labor in many areas of the globe. What we're talking about is this: the undeniable fact of human existence. We are relentlessly in conflict with ourselves, at times succeeding, but often failing to do what we know we ought to do. The Christian worldview explains why society simultaneously calls for health justice, but often finds disinterest and self-concern instead. But our story doesn't end there. Leadership in public health centers on hope. That is, an optimism that together we can improve health in the world. The question is, where does this hope come from? Can it be based on humanity alone? Many would say yes, and typically point to the forward march of science and technology. After all, look at its expanding abilities as it continues to identify cause and effect relationships, such as between HPV and cervical cancer. Develop public health interventions, such as the new malaria vaccines on the horizon. And elevate standards of living, and therefore health, for millions around the world. But is this based on humanity alone? The answer must be no, for three reasons. First, remember that public health science is not autonomous, but dependent on our ability to reason in an ordered world, which relies on Christian worldview. Second, recall that the powerful tools of science and technology are morally neutral, yet the compelling hope of public health is based on moral imperatives, which are also derived from the Christian worldview. Lastly, and here's the key, the hope for advancing public health is not just about knowing these moral imperatives, but in all of us acting in accordance with them to pursue health for all. So the hope of public health ultimately rests not on science and technology, but on addressing our moral shortcomings. And for this internal dilemma, humanity has no clear path forward. So we return one last time to a Christian worldview, which provides a foundation for the hope of public health. A Christian worldview holds that we're accountable for our moral failings, which in public health leads to the illness, disability, and premature death of other human beings. For us who recognize our individual contribution to public health and justice, this is a solemn charge. We long for a way to change ourselves and society, to see justice and compassion in the world for a time when everything will be set right. It is here that the Christian message, the good news, presents us with hope. And it occurs through the defining event of human history, that God, the source of the moral standard, entered the world in time and space to reach out to us in the person of Jesus Christ. The good news of our story is this: we all have purpose and there is hope. Christ presents us with a choice: to acknowledge our failings, to come to know God, and to tap into that purpose and hope. Through this relationship, we're then empowered to forgive and be reconciled to each other, to love others as God has loved us, and to fight for public health justice in the world. What I'm saying is this: since the central challenge of public health is our moral shortcomings, the hope of public health is found in moral reconciliation with God and our fellow human beings. For this reason, my hope and all notions of optimism and progress in public health are ultimately found in Christ, who is the centerpiece of a Christian worldview. Now, in closing, I'm occasionally asked, why did you go into public health? Or rather, why do you keep doing it, despite the challenges and the headaches? And my answer is this: as a Christian, I stand in a tradition which regards the world as a rational and ordered creation, values human beings as having intrinsic worth, upholds health for the marginalized as a measure of a just society, affirms purpose in every human life, hears a call to alleviate the suffering of our fellow human beings, and believes in hope that together we can fill the world with justice and compassion. I'm not alone. All of us here that care deeply about human health rely on the same set of beliefs, the same tradition every day. So it's not only my story, we tell this story together. The foundation of our public health beliefs are firmly rooted in a Christian worldview. So For all of us who are passionate about human health, let's examine, reaffirm, and draw on the foundations of this calling to improve health for all.